This segment is brought to you by the Kansas Soybean Commission. The Soybean Checkoff, progress powered by Kansas farmers.
Hi, I'm Mike Apley. I'm a professor at Kansas State University and part of the Beef Cattle Institute. Today I'm pleased to be a part of the Beef Today Cattlemen's College in Wichita, Kansas. And this time we're focusing on subjects for people working with feedlots. My presentations this morning centered on drug use, writing treatment protocols. We're talking about the Veterinary Feed Directive today. We went through some videos of calves with respiratory disease and then looked at lung pathology. Have a lot of good questions, a lot of great interactions, a little disagreement on clinical scores, but we're working through that. I had some really good questions on how we'd manage people who are actually pulling cattle, how we manage our treatment protocols, our records, the future of the availability of drugs. And this afternoon we're going to continue on in that vein where we'll actually discuss the Veterinary Feed Directive, how it will affect the producers and their veterinarians and their relationships, and also talk about some other current issues in the beef cattle industry involve animal welfare, antibiotic resistance, antibiotic use, a lot of different things that are happening in Washington, D.C. and other areas where we are focusing on some big national issues which are going to have a lot of effect on what we're doing here out at the field level. I've had the opportunity to be part of several Beef 101 sessions where the National Cattlemen's Beef Association and I have gone in to work with staffers in the House and the Senate in our National Congress to educate them about how we use drugs in food animals, how we diagnose disease, how we keep records, and how we're working to apply judicious use principles in an overall format of antibiotic stewardship. I've also had the opportunity to provide some staff colleges to the FDA Center for Veterinary Medicine with some great interaction there. And where both of us are learning more about what the other one's doing. So all in all, it's been very positive. Had the opportunity to speak with others in different aspects of government, and I found that whenever we're able to actually show how we keep records, how we diagnose, and how we're using antibiotics, there's often a good bit of surprise about how intense we are and how advanced we are in monitoring our use and also in applying the antibiotics judiciously. One of the things I've found as I've spoken both in Washington, D.C. and at multiple meetings to both veterinarians and producers around this country is that the dialogue is what's important. I've become frustrated sometimes at higher levels when there's a lot of posturing and the press is there, but I've found universally that when I'm able to talk with actual practitioners on the human side and veterinarians and producers on the beef cattle side, that we are in it for producing a healthy, wholesome product with great concern that we address the needs of our consumer. And I find that our colleagues in human health that are actually on the front lines dealing with cases are also very focused on the health of their patients and wanting them to have a healthy, nutritious diet. So as I talk to these groups and we get away from some of the hype and those issues, I find that really we're all about the same thing.
Closed captioning brought to you by Kansas Soybean Commission. The Soybean Checkoff, progress powered by Kansas farmers.